Okay, so we're going to start out with our labor perspectives on workplace psychological health and safety in healthcare and long-term care, a panel discussion. And I'd like to introduce our moderator for the discussion is Sally Wells. Sally graduated from Memorial University in Newfoundland in 1977 with a Bachelor of Social Work. She then worked for 5 years in psychiatry and family medicine. She graduated from UNB Law in 1987 and was admitted to the Law Society of New Brunswick in 1987. Sally practiced law in a small firm, followed by a 10-year term with the Law Society of New Brunswick, where she was Director of Continuing Legal Education. For the past 24 years, she has operated a successful practice as a workplace consultant in Atlantic Canada, specializing in workplace mediation, respectful workplace investigations, and seminars. Sally teaches dispute resolution at UNB Law. She is well known for her practical teaching, joie de vivre, and her ability to make people laugh while learning. In 2018, she attended a mediation retreat in Tuscany, an opportunity to meet with world-renowned mediators and scholars. This experience has provided new approaches for dispute resolution within the traditional legal context. It is my pleasure to welcome a colleague that I've worked with for many years, have known
many.
for 20 plus years. Sally, thank you for joining and agreeing to be our moderator for this panel discussion.
Thanks, Sheila. My pleasure, always. Thank you. First of all, I really need to publicly acknowledge all the work that the committee has done in getting this pulled together. It's mammoth, a huge job, beautiful work, and very necessary, especially in light of what's been going on in the world pre-COVID and, of course, during and now post-COVID. And before we start, I'd just like to thank my panelists as well for being here today. I know some of you have done other presentations as well, and you're doing double duty, so thank you for that. So we're going to have 4 questions, basically. I'm going to ask each panelist to answer one at a time, so we'll do like a round table, and we'll leave some time for questions and discussion towards the end of the hour and a half. So before we do that, let me introduce Cathy Rogers, our Research and Education Officer with the NBNU. After 17 years with the federal and provincial governments, economic development, public safety, industry, social services, 14 years in academia, sociology professor, and 6 years in politics, Minister of Social Development and Minister of Finance, Dr. Rogers now does research and education to support NBNU's nurse members. Wonderful. We've got Joyce. Joyce O'Coin is our coordinating labor relations officer for the NB Union. Joyce has 26 years experience in nursing homes with a BA in phys ed and in gerontology and is bilingual. She joined the staff after 8 years as an NBU activist and 6 years as president of Villa Chaleur, local 20P. Sharon, who's not joined us just yet, but will be coming shortly, we hope, is the president of the New Brunswick Council of Nursing Home Unions and first president of CUPE Local. Sharon is a nursing home worker, and in her role with the CNHU represents 4,400 members in the nursing home sector. And we've got Norma, president of the New Brunswick Council of Hospital Unions, and she's been with them for 15 years, representing 11,000 members. So we've got a fabulous panel here representing people that are out there doing all the frontline critical work and who need a lot of guidance and support vis-a-vis trauma-informed workspaces. So perhaps I'll start with you, Cathy, with our first question about whom you represent and how you see what's changed over the course of the pandemic.
Sure. Thank you, Sally. First, I'm with the New Brunswick Nurses Union, and we represent approximately 9,000 nurses, licensed practical nurses, registered nurses, and nurse practitioners in a variety of settings. So even pre-pandemic is a point I always like to make. Pre-pandemic, there was a nursing shortage. Mm-hmm. And so with a workforce shortage, you see working conditions deteriorating and you see life more difficult at work. So that's pre-pandemic. And so obviously, since the pandemic, it's exacerbated the workload, stress, fatigue for an already understaffed workforce. And I know this extends beyond nurses. It's healthcare staff and all kinds of team members. And this is likely largely due to absences because of COVID isolation after exposure, because of sickness, but also at a time when the healthcare demands are the highest because there are more needs with the pandemic happening. In short, the workforce is getting smaller and the demands are getting greater. So working short means working more hours, going without breaks, without vacation, and according to many nurses, without even washroom breaks or drink and food breaks. This leaves them with fatigue, stress, burnout, and it impacts also their personal lives. And it creates what they call moral distress because the care that they know they should be giving to their patients, clients, residents is not able to be fully provided and they go home worrying about that, So in a nutshell, that's kind of the effect of the pandemic, exacerbating already difficult situations.
Exactly. And I think too, we have to acknowledge that there's just so many systemic as well, pre-pandemic and public policy issues that have impacted so much of this. That's a much bigger picture for us to kind of tackle. Okay, Joyce, tell us about your members and how they've seen things change during the course of the pandemic. How has it impacted them?
Sure. Well, New Brunswick Union in the healthcare sector, we represent almost close to 5,000 members in two groups. First group is our specialized healthcare professionals. This would be our social workers, psychologists, audiologists, speech language, on and on. With most of them servicing in the mental health part of that. And then we have another significant large group in our medical science professionals. So this would be pretty well all your diagnostic people, the paramedics. That's a significant group that has been added to our. So a variety, and again, they're in the hospitals. They're also in community health centers and so on, and community and things like that. And we also have another small group, although they're not in part 3 of the healthcare sector. I still include them in healthcare because this would be our professionals of the school system. So there are psychologists and social workers, which are actually dealing with healthcare issues, particularly in mental health addictions and things like that with school age children. And that's another almost 400 there. So very much like Cathy said, pre-pandemic, workload. The workload kept going up, do more with less, yet the numbers of resources, people, wasn't being added. So people had to do more and more. We kind of saw overtime as becoming the all end and all to patch those exit, when we have to take care of a wait list that's growing. So people were already stressed. Both of our groups, I think healthcare workers in general actually are an aging workforce, and not that's a negative thing, but it's certainly experiencing as the nurses, retirement is a lot closer than the beginning of the career. And shortages, and we were already seeing shortages in critical areas, particularly social workers, psychologists is horrendous and still kind of horrendous. So that was, I guess, the norm, the abnormal, I guess, pre-COVID, and then COVID just blew that up. It's like everything pre-COVID is now 100 times worse. Workload, you already had a heavy workload. Now you're adding not only more to do more, but also in a condition where the condition on the grounds have totally changed, right? Okay, well, we had to go online. We had to figure out how to do that. We had to, even if you were one of the ones had to be in the workplace, well, at the mask, at the gown, you had to get all the precautions. So that takes away time, of course, and the whole ability to deliver the service, obviously those stressors, and obviously with COVID, like nothing stayed the same. You know, you'd say, okay, I think I know what I'm supposed to do, and a month later, everything, all the rules change again, and you have to readjust and readjust. And I think as human beings, we're not made to readjust that frequently without some kind of a period of, you know, being able to you know, settle down and do something. But you know, so we are certainly seeing again. I think COVID has put people's you know, how would I say, not just expectation, but people's have reassessed. Is this what I really want to do? I've always said to some of my members, it feels like we've lived 10 years in two. Right? All the experiences we would normally had in 10 years feels it's all been condensed into this tiny little period of time, and we're still not out of it, right? We're really not still out of it. You just feel like you're in a holding pattern right now, waiting to see what comes next. So people have left, people have decided to change careers, people have decided to go to other areas that offers them more flexibility, you know, a more balance in their work life. And the stressors are certainly sky high. And one of the elements we're seeing as well is this settledness, management, HR, everything's like if everything's on a revolving door. You think you're dealing with one person, and okay, you build those relationships, and the next thing you know, it's somebody else, and you haven't even gotten used to the one person, and you're with somebody else. And even a lot of the people coming in, well, they're not experienced. It's, you know, it's not a criticism of these people. They're sometimes injected into areas where they haven't been given, you know, that normal period of adjustment and getting into that job.
Yeah.
And so that creates, I think, an uncertainty, you know, trickle down uncertainty, because as an employee, then you're looking up to you had this manager, and a couple of months later, you got a new manager, and new manager, well, you know, you got to take what you can get sometimes, and is probably newer or less experienced than you are. And how, you know, and then next thing you know, that person's gone. And on top of all that, we're adding more programs, or, you know, and it's not a bad thing. We need more mental health programs, but we don't have resources. So it's like you're stretching that resources thinner and thinner, trying to provide more types of services that are direly needed. But, you know, you can only do so much with, you know, we can't split, what do you call it, split the baby into, you know, multiple pieces.
Yeah. So Joyce, if I may for a second, I think that's fabulous, and everything you've said is absolutely bang on. And I think one of your references to, you know, that whole thing about we had to, and I think the word in the day was called pivot. Everyone has pivoted. So I'm going to pivot now over to our other speaker, Norma, unless Sharon, I don't know if Sharon's on or not.
Don't see her.
No. Okay. So I'm going to pivot over there to get Norma's perspective, and then we'll come back to you for our next question. But thank you so much.
Thank you, Sally. So with respect to the representation, those that I represent, there's 130 classifications, so I won't go through them all, but some of the prevalent ones that I think of rate with the pandemic would be the environmental services worker or the cleaners, food and nutrition, pharmacy tech, sterilization, security, admin support staff, patient care attendants. We represent members in mental health, public health, extramural program. So it's a very wide variety of classifications, and they all are very much integrated into the healthcare system. So when we think about the pandemic, I completely concur with the two other panelists with respect to what's happened and the effects on the staff and the members that we represent. But one of the key things that I've seen change with the pandemic, and Joyce said it, this, and Cathy as well, this didn't start with the pandemic. This started many, many years ago. Like I can go back as far as 2005 and come forward and see multiple changes to the system that was never addressed. There was reductions, there was staff leaving, complements, education, classes weren't full. So there's multiple things that's got us to where we are today. But one of the significant changes that I witnessed through the pandemic, and Joyce alluded to it, was the pivoting and changing daily, minute by minute. because you would have a communication come out in the morning and maybe by noon have another one. By 3 o'clock in the afternoon, have another one. And staff are so busy and working short, stressed, burnt out, the fatigue, the mental anguish of not knowing what this pandemic meant for them and having to deal with frontline clients or patients that did have the virus. They didn't have time to read these communiques, and it just left more frustration and more anxiety. And that's the biggest thing that I would say during this pandemic is just the unknown, being unaware, unprepared, and just being left with questions and not getting the answers. And we have to remember that in healthcare, we have the CEOs or the health authorities that sit in one area of the province, and we have managers, but not in every facility. So there are areas that the staff were being left with no answers. And that was extremely problematic. And that's not just for those that I represent, that's for every healthcare worker.
Well, the other thing in healthcare is some managers have so many direct reports, 80 and 90 people. How is that even possible? So,
well, and they actually may have 3 or 4 facilities that they're looking
Yeah.
after. So
Yeah,
it's impossible for those managers to be
it's
in
not
every
possible.
facility. Exactly.
Yeah. All right. Thank you very much. Any sign of Sharon? No? Okay. So I'll go on to the next question. And I think this is a really important question in terms of what does trauma-informed workplace or workspace mean to unions and their members? Because I think it might mean different things to different people. But I think it's fair to say that psychologically, physically, personally, and professionally, everybody was impacted, especially frontline healthcare people, no matter what their role, like you just said, the number of people that are involved in that system. And how do you work remotely when you are in some of those jobs? You can't, you have to be on site. So what does a trauma-informed workplace mean? And Cathy, I'll start with you. And I think we'd like to look at it in the context of what is a respectful workplace.
Well, I think first and foremost, it means employees feel respected and understood and heard. And I mean, really listened to for the frontline expertise that they have in their jobs for many, many years. It means being cared for and supported in their needs for well-being at work. It means when a member or employee asks for help and identifies where the need is, that there's someone to listen and take action on it. You know, I've often listened to Michael White, who's a narrative guru, and you know, he talks about double listening. So listen not only to the words being said, but what's behind it, and what's you know, what are the values informing this? What's behind even the words? So I think, you know, you have to consider your employees' whole health, and that's a mental health, physical health, their family situation. And it can be difficult because managers are busy. You know, we just finished talking about that, but you have to consider and maybe do some better education and training and opportunities to build up resilience, to offer, you know, what can I do to help you have life balance? And you know, how can we help to enable intentional self-care, positive attitude, mindfulness, etc. You know, because all those things are important to really showing empathy for the worker and care in the workplace. And that would be a trauma-informed workplace, recognizing when there's more training needed because people feel insecure and anxious. You know, in short staff, I'm sure you can all agree, my colleague panelists, you know, when we're short staffed, we've got, in the nurses, for example, LPNs are called on to do work that's outside of their scope, and they're scared and they're anxious. And so it's recognizing things like this, giving extra training to help. But first you have to understand and recognize it and value the employee for what they are. And, you know, align with what is, you know, standards for psychological health and well-being. You know, I could go on, but I think those are the essential things, is to listen, understand, and respond.
And I think that's a really good point too about intentional self-care, even if it's a micro moment of taking time to look, get your water, take a little pause, just take some moments of that. I think the intentional self-care is important, but I think people are just feeling so dedicated and they're so bound by their professional obligations,
Yeah,
that
and so
moral crisis,
overwhelmed.
they're
Yeah.
overwhelmed. So, the self-care comes last.
Yeah,
And I
in
think we
fact, I
need
hear
to,
that
as
all the time.
yeah, and as employers, we really kind of need to, I think, support more of, look, yeah, you need to look after yourself before you're going to look after everybody else. Okay, Joyce, you're next. Tell us a little bit about what your members are saying to you about what it means to them to be in a trauma-informed workspace.
Very much as Cathy said, I mean, to be respected, and it's for some people, that word, well, what does that mean? I mean, to me, it means that you recognize my skill set, recognize that not everybody may be at the same spot. People have different strengths in that, and you can't expect the absolutely same output out of everyone. We're all human beings. We're not. Validate people. Oftentimes, you're going along, and bam, something happens, and you get called in. Like, it just seems, why is it the only time you have those conversations with your managers when you do something wrong, right? You need to validate people that you're doing great, and not just you're doing great, but I value your opinion. It's like like a lot of members will say, particular professionals, and I'm not. It's like everything gets done, or we're told what to do, but we're not necessarily explained the why. And perhaps if I understood the big picture, it's easier for me then to know what my role is in that picture, right? Rather than it's like, here it is. And especially like Norma was saying, all of a sudden the rules change and nobody knows much what's going on. If you're a manager, you're not one of the lucky ones that has the manager actually in your workplace that you can go knock on the door and ask for that validation. You have to do everything by email, or you have to wait for an answer if you're lucky enough to get that answer at the time you need it. So there's certainly, people are more and more saying, I don't feel supported. I wish I would be supported. I wish that I would get more training, and training now is like everything's online. There's no like, where's the personal touch? Like, I really feel bad for when new employees coming into the system, because I know when I started, I won't say when, how long ago, but you came in and you're the fresh kid on the block, but you felt mentored. You felt there was always someone there. If it wasn't your direct manager, you had someone who would take you under their wings, and you could learn from them and get to know there's the work rules, and then understand what's going on. But you weren't. It's just feels now you're thrown into the deep end, and if you come back up, oh, I guess we'll keep you, and if you don't, well, I guess too bad. It's just people are being supported, so you respect is not just a word. It should be it should be a culture in the workplace, right?
The culture, and that's up to leadership really to develop that.
Exactly.
Yeah. Okay, Norma, what about you?
Well, I won't repeat what the others have said, but I think that one of the major things is that the staff, they need to be heard. They can't be dictated to. They need to be part of the solution. They need to be engaged. There needs to be conversation. And the biggest thing is respect. And I think that's a two-way street, because when we talk about a healthy workplace, we want the employer to provide a healthy workplace. And we also as staff want to be healthy in our workplace. So, like, I think if staff are engaged, if they're well educated, it goes on beyond the pandemic, because what I've witnessed over the years, and I've been in healthcare for 35 years, president of the council for 15, but what I've witnessed is we are now teaching ourselves. We are now being the educators of our own future. And I think that when a pandemic happens, that's when everybody gets into, the position where, oh my God, the sky's falling and we need to do this now. We need to be informed and educated ongoing rather than wait for something to happen. And I think that a big thing with a secure and healthy workplace, or a trauma-informed workplace, is there has to be security. There has to be security that things are happening. We have to see that there's positive change, and we have to be part of the solution. And right now, what I witness is things are happening because someone's told someone to say it, rather than it's it's felt and it's heartfelt, and we're
Mhm.
doing this because we care about the staff. It's more because someone has said we need to make the staff feel more inclusive, and it's happening today because of the pandemic. But on a go forward, I think that we need to really consider what that looks like and engage and listen to them, because quite frankly, the frontline staff, all healthcare workers, will have great solutions and will work with management or the employers to have positive change, because nobody wants to go to work and be stressed out and upset all day, but that's what we're seeing.
Yeah. And I think that's a really good point, because people that are doing the work actually have the solutions because they're doing it. So they know what could work, what's possible, what's probable. How can we look at this differently? Can we maybe share X, Y, Z? Maybe we can do 3 days and you can do 2. And we need to look, I think employers really, really have to open their eyes that there's other ways of delivering service, so that maybe you've got 2 people that can do 5 days instead of one person doing 5. You might have someone do 3 and someone do 2. There's all kinds of ways that people could come up with solutions. But people in positions of power and decision making who have the purse strings need to really listen to all those solutions, because I do believe they're out there, and I think you're absolutely bang on with that approach. I think there's just no way around it, and that being heard is critical to getting some of these things resolved. No question. Okay, Cathy, back to you for question number 3. What are unions hearing from their members about what trauma-informed or respectful workplace means? Has it changed or shifted? Because when we first started talking about respectful workplaces back in the early 80s, or, back in the day, it was called workplace harassment. Now it's way beyond many of those things. And we're looking at much more about being heard, being seen, being appreciated, emotional intelligence, people being celebrated for the gifts that they bring to the workplace, all of those components around respect. What are you hearing about what that means to your nurses?
Thanks, Sally. Good question, because as we're talking about trauma-informed workplace, I might like to make a point right up front that when we talk about trauma, we're not just talking about one incident.
No.
We're not talking about, what is the common cliche. We're thinking about a childhood trauma that still impacts us today. There can be that, which still is lurking in the background. But we're experiencing more and more chronic trauma every day.
Yep.
It's really traumatic when, as nurses have told me in a couple of surveys that were done this year, I feel anxious and depressed and scared when I'm going into work that day, because I don't know what I'm going to face. I know I'm going to be short. How much short? And where am I going to be floated? Am I going to be put somewhere that I have no training, or am I going to be called upon to perform a role that's beyond my scope? And so they're starting with that anxiety, and they're having insomnia. It's so chronic, it's creating depression. So increased anxiety, depression, insomnia, and just, a feeling of dread going into work means that we are experiencing trauma. And then add to that, in the healthcare profession, you're meeting trauma in the emergency ward, or in the nursing home, where you're greeted with, 60 residents for one nurse.
Yeah, it's unbelievable.
It's overwhelming. And so I think first we need to remember that trauma is not a disorder.
No.
And it's a symptom or outcome of injurious situations and events and environments. And when it's chronic, it creates chronic mental and physical health problems. And we see this. So what can employers do? Well, they need to, again, listen. And I keep going back to the listening and knowing and paying attention. I think all 3 of us have talked about the value of, and Sally, you reemphasized it just a moment ago. If you listen to your frontline workers' ideas and solutions, even if they don't see what's happening on another frontline, if you listen to all the front lines, the management and decision makers and policymakers can put that together so that things work better. But we have to recognize and hear and listen. And even employers, I believe, like direct supervisors and managers, have a responsibility to recognize types of traumas and even triggers. and
Mhm.
provide opportunities for debriefing and training, which
Mhm.
I'm told by nurses are too rare. You know, they're
Well-
facing trauma on top of trauma, and they don't have an opportunity to debrief because they're running to the next trauma. And then they go home just deflated.
Well, exhausted and deflated.
Yeah.
I mean, because back in the day, we used to have critical stress debriefing, incidents. I mean, we had that as part of our support for people. Well, everybody needs it now. I mean, and I'm not being flippant when I say that. There's more people now that need that attention and support because, like you say, they wake up to go onto their shift, they get ready, and they've got knots in their tummy. Their heart is palpitating. They're anxious, their heart rate is definitely accelerated, and they're nervous and scared because they're not sure what they're going to face, or they have to make some very critical decisions about who's going to get them for a minute or two or not, and then what the impact of that is going to be because somebody else's life is at risk.
Yeah.
So,
and I mean, I've heard people say, pull up your bootstraps and just get on with it. We had to do that.
Oh my
Well,
gosh.
no, it's not the same. It's not
No.
the same at all. It's
No.
too chronic, too repetitive.
Yeah.
It's become systemic.
It is systemic, and the pull up your bootstraps or put on those big girl panties, which I'd like to take that phrase and throw it out the window with everything
know.
else. I'm sorry, throw that in the trash bin. That is not a good phrase. You don't need to put on your panties, okay? That's not what this is about. So trauma-informed managers or supervisors or people in positions of power would not use that phraseology anyway. Yeah. Okay. Joyce, what are you hearing?
Well, I mean, I think, and it's, Cathy's absolutely right. I mean, we're all, we all can do, all professionals, when there's a crisis, there's all you can act, right? You know what to do, you're trained to do it, you do it. But we're in a constant, we're always in a constant mode of critical, I mean, there's no coming down. And that's obviously impacting people's mental health. And it's, I mean, you become sleep deprived, anxious and all that, it builds up and, and it just, problems keep getting worse. So for us, as we see it, we're at the point now we have to, stop asking people to do more with less and less. We need to provide manageable workloads. I know we're short, but we can't keep relying on people to, stretch that rubber band, because the rubber band has been stretched as far as it can go. It's going to snap. And then once it snaps, we're all in dire trouble. So it's not necessarily something easy to do, but we have to give people manageable workload, and we have to support people, particularly professionals. They've been trained, they know what they're supposed to do, but they need to know the why. They need to have the guidance. What is the purpose of this program? What is it I'm expected to do? And allow people to do it and not keep throwing more and more and more on top of the pile, because it's just going to collapse. It's like the big, house of cards, right? You just put that one last piece and the whole thing comes down. And whether it means that the government starts coming up with, we need definitely more people, but if we can't get professionals right away, well, then we have to come up with solutions that can relieve the frontline staff, relieve them from those tasks that, anybody can do. But you have to give them a manageable workload. I think we're at the point, the people cannot, they've done everything they can do within their capacity. And if you're going to want to keep those people, you have to do it. And if you want to attract people to this profession, I've used this example in a lot of other, things I've said, is that, like my generation, well, we came in, it's like the pot, the frog in the boiling pot. They throw me in the pot's fine, the water's good. And, you ramp it up. But, you don't really realize sometimes you're in trouble until it's too late. But the fact is you learn, and after a while you build up that resiliency, whatever, and, you can tolerate a lot more stress. But the young people coming in, they're all gung-ho, all, bright-eyed and bushy-tailed, and the next thing you're throwing them in the boiling pot. They're not going to put up with that. Like, it's just a shock to the system. It shocks me today when I see a young social worker coming fresh out of school that is doing the workload of an experienced social worker of 10, 15 years with very acute cases.
Mhm.
And not necessarily, and I, support it from the upper management, like, thank God there's still enough colleagues in the workplace to help her, but, they're saying, well, gee, this is too much, too fast. Like, it's just, so we have to give people a manageable workload. We have to train, and we talked about managers. The managers have become, they're not managing the workforce. They're not managing the resources. They're managing programs. They're managing budgets. They're managing everything above. Like, where's the manager that recognizes, what my team needs? Who needs what, when? Be proactive. Provide that support. Validate. Help mentor people through. Right. So I guess for me you got to respect people. You have to respect their capacity, and you can't burn people out and expect that there's going to be someone behind them to pick up, because it's not there. We have to change, and like Norma alluded to earlier, COVID, we did what we had to do with COVID, but we can't wait for a next COVID or next virus and expect that same degree of action by our members, because
Well, yeah, we've already acknowledged that pre-COVID, this was already happening. We were
Exactly.
already creating trauma workplaces for people because of the anxiety, the knots in the stomach, working short, working double, triple shifts, not sleeping at work so they could wake up and, maybe grab an hour and then fill in for other people. Like, people have experienced this long before COVID was a thing, but COVID has exacerbated the actual trauma for people working there in healthcare and in other areas. And so, some of those systemic public policy issues, how do we get to the root of that and really, get something happening? And I don't know, anecdotally, I've heard that people can go somewhere to a northern part of another province and get $220 an hour and have their living expenses paid. And I mean, I say that can't be true. That can't be real. But is that where we're losing people to? And why aren't we keeping those wonderful people here where they're needed? Where are the solutions? So I'll throw that out for some discussion a bit later. But now I want to get to Norma and see what some of her members are saying about what that respectful workplace actually means, and that trauma thing that's been sort of created pre-COVID, but more so now since, of course.
Well, and quite frankly, what I'm hearing, and it's across the province, is extreme frustration. There is just the respect. Quite frankly, there is no respect. I don't know I know what's caused it, but I think that the pandemic has just amplified it by 100. I mean, there's refusal, there's denial, there's stress, there's burnout, there's job security. I mean, everything right now in the workplace. Some may say that the workplace is respectful. They may say that people are going along and they're actually doing what they need to do. But I see the frustration, and I see the poison work environments that it's causing, because we end up having staff getting into arguments because they are frustrated and stressed and burn out from doing, as the others have said, the work of 2 and 3 other people. And it just seems to get more and more every day, because earlier we asked in the chat box, the question was asked, is the media aware of this? Yes, but the media sometimes causes a lot of frustration as well, because with right now, with the state of healthcare, and we're not sure what's going to happen. The staff and the members that I represent are saying, am I going to have a job? Is my facility going to be open? So the stress and the like the job security and not knowing what their future holds is causing a lot of disrespect in the workplace. So if I was to say, is the workplace healthy right now? Is the workplace, is the employer, putting out things to help have a respectful workplace? They're doing what they normally would do, but I don't see any extras. So the people that I represent are extremely frustrated, because they are seeing that it's the same old with nothing changing. And there has to be change. There has to be positive change that they see that is impacting their workday, helping them get through the workday so that they can go home and have a healthy work-life balance and go home to their family happy, instead of going home upset and mad and taking it out on the family members. And quite frankly, I don't think your family wants to hear about your stress in the workplace. They prefer to have you come home and have a decent conversation. But everything that the other two have said is exactly what we're all experiencing with our membership. They're going through the same thing. We're all in this together.
I think you bring up an amazing point about people's families. I know I used to say to people, look, when they were experiencing disrespect in the workplace, how people would go home to their family and say, oh my God, you wouldn't believe what happened today. And eventually the partner would look and say, look, I love you very much, but guess what? I can't do anything about what's going on in your workplace. So could we agree to set a boundary that you're not going to talk about that when you're home, unless you're going to do something about it in your workplace and go to the right place? I can't help you. I can only listen to you so much because I can't do anything about it. And they feel powerless. But I think what's happening is people are going home depleted. They're exhausted. They don't have anything left in their tank. So even doing a basic maybe household skill or talking to your family members is overwhelming, because they might need to have a rest and a little debrief first, instead of hitting the ground wondering what's for dinner or who's got to get the homework sheets filled out, or like yesterday, the first day of school, all that paperwork that takes you 20 hours. I mean, seriously, they're going home depleted. So that isn't respectful in a workplace to create that kind of exhaustion, that kind of angst and anxiety. So definitely that's a part of our work-life balance. Is we're looking at a global picture. We're looking at communities, families. We live in communities. So what are we doing to support all these frontline workers who are doing such good work to support our community? Because it's affecting our community. And there's families who who've got people waiting for surgeries and different medical interventions. They're looking for doctors. I mean, it's a bigger picture. And then all the people that are holding together are all the people that you're talking about today. All your members are holding this together with the best they can, with what they have and what they know. But it is very tricky. It's very hard. And, really, we're not honoring them enough or celebrating them enough. They need more safe spaces. We need to give them some safe spaces where we can do that within the confines of the workplace and not have them have to take it home to affect and impact others who can't do anything about that. So I think we really need to look at some of those solutions around what can we do in a safe space to help everybody. And that's paying attention to mental health, physical health, some of those micro things that we can do as an employer to honor some of those things. So I'd like to know now, I'm going to go back to you, Cathy, with our last question. It's like, what would the unions like to see changed to ensure some of these things? I'd like to look at are there some practical, functional things that your members can imagine that are possible and doable to create that?
Sure. Yeah. We undertook 2 studies of our nurses to see how they're coping and how they're faring in these really traumatic last few years. And we never really asked in our surveys, which is interesting, did not ask the question, what ideas do you have to make things better? But almost everyone offered solutions and ideas that they have actually said that they brought forth over the years, and they didn't feel heard, they didn't feel listened to. It was as if what they had to say was unimportant, or they don't know and they don't understand like we do, and so they just felt unvalidated, but back to the other questions, a trauma-informed workplace is a respectful workplace. They're hardly separatable. But so what would, from the nurses, I hear they want some degree of balance. They want a workload that's put on them to be able to be done in a day. So how do you do that when you're short-staffed? Well, it is very difficult, but there's many ideas that had been put out there. I think, I can't remember if it was on the last session or if it was here, that somebody said, meet people where they're at. If somebody has part-time availability, invite them in and get 5 of them. Honor flexible working hours.
Yes.
We've got to start getting there. We're in a different world now. we have to start looking at flexible working hours, honoring the health and well-being of the employee as a person, not a robot, not a thing, you know, and human beings, in order to not just survive. That's not our goal. Our goal is to thrive, to flourish. It's not survive. We're in survival mode now, and we're hardly surviving. So if we want to thrive and flourish as humans, which actually gives better outcomes in healthcare delivery and better outcomes in the community at large, then we need to do things like honor breaks, honor some vacation so that we can recover. Those are quite basic things, you know, that's not rocket science.
No.
And you know, I think it was Joyce who said, you know, you can't get new professionals overnight. That's true. But hey, why not identify certain labor force shortages and say, we're going to invest deeply in these, and we're going to pay your tuition or your costs of whatever, and we're going to ramp things up so that we can remove barriers and get more people in here. At least we're taking, if we don't do any action for 3 years down the road, we're not going to see anything different in 3 years. So there are some things that we can do. And number one, I'll go right back to what I started with. Listen to your frontline professionals. Listen to what they experience. And I think the solutions are there.
Yeah, I agree.
They know what their barriers are. They know what's interfering in the ability for them to do their jobs. They applied for these jobs and are you know, still working hard, giving their all to the point that their cups are empty and, you know, my cup overfloweth. You know, they're experiencing all that right now. The only reason they're still there is because they do love their work, and they love the people that they work to improve the lives of. So they're there for a reason. Let's honor that, and let's talk to them about what they think would make them do better. And therefore, I think that's where the answers are. I really do. You know, they're stressed. They need to be heard.
Yeah. Well, you gave that example of you know, looking at the labor force shortages and perhaps maybe funding a program where the tuition was supported and paid for. They actually just did that in Prince Edward Island with correctional officers. There was a shortage, so the government funded a program for people to have their tuition at Holland College. And so the people graduated with a funded program, and every one of them are working full time. I mean, there's
We've done
your
this
answer.
with truck drivers. We've done
We
this
do
with
it.
different.
NBCC has been doing it for years. They
Yeah, I
respond
know.
to what the community needs.
Yeah.
It's not new, but it's so practical and functional. And the long-term investment, it's an investment. So if we do our own investing and we look at our ROI, what's our return on investment?
Yeah.
My goodness, think about the return on investment and how this province could thrive if somebody could change their way of thinking. I think the other thing that's important that you talked about is maybe look against some of the other professionals that their scope has broadened. For example, occupational therapists, their scope has expanded somewhat in the last 4 to 5 years now, so that they can do some of these. They bring the skills into workplaces like care homes and hospitals and schools, but you don't see them there. There's no place for them, but their scope of practice is so broad. So, you know, where is that at the round table? You know, for example.
Exactly. Let's
So
brainstorm.
the
Think out of
answers
the
are
box.
there. The answers are there. We're just not finding them because we still haven't shifted our thinking from that, you know, economic partly and political bigger picture.
Yeah, we get stuck in boxes, don't we?
Oh my God.
We think of the way things always were, but we've got to escape those solid line box boundaries and get creative and innovative and think of how we can do better. And I think the frontline workers have some of those ideas.
They do. They absolutely do. So I also, before I get to you, Joyce, for that last question, I'd like to invite the participants to pose questions. You've got this amazing panel here of people, and we'd like to ask you to post questions so that we can get ready to answer some of your questions as well from the audience. So Joyce, I'm coming to you next for that last question about what would some of those changes that your union would like to see, or your membership, around creating some of those more practical functional solutions for respect.
Yeah, certainly. I think, one of the things we have to start doing, governments have to start doing is healthcare dollars need to be spent on healthcare. We
Mhm.
receive money from the federal government, all that, and all of a sudden some of that money doesn't go where it's supposed to go to. Because there is money, just as being not put where it should be. And by now, I think we should all agree, every single dollar we have available should be going into healthcare. Certainly, we need to amp our programs. Unfortunately, in New Brunswick, we've outsourced a lot of our education system. Programs are not all available in New Brunswick. Some are, some aren't. Some of our members have to go out of province to get that education. But I think, yeah, we're at the point we need to start investing into the future and saying, well, if we need to pay all or part of people's tuition to go there. Certainly, when you go back 30 years of what tuition was compared to today, I mean, it's not, it's a lot of it's just not affordable. And we need to start that now, or we should have started years ago, because as a union, we've been saying this for more than 10 years ago. We've been saying you need to get going, because we have a lot of people going to be retiring in the next 10, 15 years, and you don't even have enough people graduating to just replace the people retiring, let alone people that would be leaving. And when I say education as well, it's not just trying to educate new people into the system. You need to educate continuing education for those who are in a system. So if you have somebody comes in entry level right now, I'd say, okay, anybody who's interested, really interested, and maybe they may not be sure yet that they want to be, I don't know, a social worker, but they might be willing to say, well, I'd like this, entry level type program. And if I knew I would be supported, that as I'm going along, that I could continue my education and maybe eventually become that social worker and have some support, bursaries or whatever, I think that will then attract those young people to not only stay, but flourish and thrive, as Cathy said. And we have to start talking to the young people. And I'm not saying, I'm talking young, 14, 15, while they're still in school. Offer them opportunity. We don't expose our young people enough to be able, I mean, we used to have candy stripers, right?
I was one.
But it gets you into that environment. So you kind of say, well, this is great. It's not so scary because it becomes more familiar, and it encourages people. And sometimes, that will become a nurse, whatever. But we seem to not have that connection with the young people. So when they finally graduate, many of them are not even sure what they want to be, haven't made those, real commitments yet, because they're a lot more open to stuff than we ever were. So we have to start making those connections, and we do have to be more innovative. And a lot of our members, I'll give you an example. We also represent a couple of nursing homes in the province, and in one of the larger nursing homes, we worked with the employer, and we started. It's a pilot project. I don't know where the government got. We've proven that it works, but essentially we created a new classification of it's like an aid to the to the care workers, because we realize that, look, people are short-staffed. People can't. The workload is immense, and things are are slipping by. So any of you familiar with nursing home, everybody's supposed to give an actual full bath once a week. Yet, oops, you're short-staffed. So Mrs. Brown doesn't get her bath this week. Well, then maybe she won't get a bath till the next week, because you also don't have any excess staff to make up for the next day. So this kind of a care aid to the care workers, basically took on all those tasks that are not related to direct patient care. Stocking shelves, delivering trays, doing all those things that have to be done. You still need to do it. And we kind of call them sort of a candy striper 2.0. It's sort of and it really worked. And it was meant to not necessarily, it was attracting some of the young people, or maybe someone who maybe just can do part-time work to come in on odd hours and, be able to stock shelves, do all that. So when the care worker comes on their shift, well, they're not having to spend an hour of their shift going to get some towels and sheets and supplies because the other staff before them didn't have time to replenish a cart,
yeah.
or whatever, right? And if they had extra time, well, they could spend it with the residents. They can, go talk to residents. They can, and one of our goals in the pilot project was to ensure that that baths were being given every week, and it freed up enough time. Now, mind you, COVID hit at the same time our pilot project, so it's a little tough there. But I tell you, my members sure appreciate have those couple of extra aides around during COVID. And like they said, they really hated to see them go. And a couple of them have actually going to go take the LPN program as a result. So for us, it achieved a goal. One, we were able to help our members with the workload, and we've actually attracted a few people that may not have chosen, working in a nursing home as an option, and they now decide to take the education. So and that came from the workers. This was true bargaining, and our workers mentioned, like, couldn't we just get help with those things and it free us up? So I think that the solutions are there. We just have to listen to people and not just have these reams and reams of studies that sit on the shelf.
Yeah.
All these consultants and all that stuff. I'm not saying, but sometimes the simplest solution is the best solution, and you don't have to spend a whole lot of money to get there.
Well, that's very encouraging. That's a very practical, functional thing, and it worked. But I'm laughing when you say candy stripers, because I was actually a candy striper in a hospital, the general hospital. And then because of that, I ended up being a social worker in psychiatry after. I worked in a hospital again when I graduated from school. So it's kind of interesting because I started in grade 8 being a candy striper, which led me to study that when I graduated from high school. So it's interesting. And then, of course, I moved on to what I'm doing now. But I think too, I think what you were describing too in those care homes is, that whole idea of triaging, what's most important, what has to get done. I mean, can you even imagine that you have somebody in there that needs a bath, and which is a simple function that we all take for granted on a daily basis, and you can't get a bath? People can't believe this. Where's the media when we need these stories? I'm sorry. Where are they advocating for change? Where are they advocating for some of this frontline solution? We need to have awareness about how critical this is, and that the trauma that it's creating for our employees, but also for the people who are at the receiving end of not getting the simple basic function of a bath. There's a good point. All right, so Norma, I think there's some questions and answers too. I'll check the button in a second, but we'll let Norma finish up with this question.
So one thing that the union, well, there's several things the union would like to see, but I think we just need to ensure that all healthcare workers are being respected. We need to educate. We need to have that face-to-face education. We need, the workplaces need to form respectful workplace committees. They need to have some ad hoc committees, get those frontline staff involved, get the perspective, get those ideas rolling from those frontline staff. They need to change their hiring practices. They need to look and make the work attractive. Right now, quite frankly, healthcare has been in the media in a very negative light for the last several months, and it's not getting any better because of the situation we're in. So there has to be some work put into why is healthcare attractive and how can we attract people to it. As Cathy said, they need to have their rights honored. We need to have staff getting their breaks, getting their lunches, having that time away from work and not having everything denied at the onset. They need to invest into those that are working in the system. They need to invest, whether it's through education, if there is opportunities for advancement, there needs to be that investment, because we continue to hear that, we can't put money into wages and benefits, but there's other ways to invest into your frontline staff other than, yes, wages and benefits absolutely are needed to attract people in, but we have to also invest in those that are in the system. And we have to stop seeing staff as the problem. Staff are not creating the problem. Staff are not the problem. And we need to hear from the bottom up instead of from the top down, because it just seems that everything that's coming out, I myself as a staff member will say, where is that coming from and who are they
Mhm.
getting this information from? Because to me, it makes no sense. But if they came to the frontline staff and asked those questions and actually put the effort in to finding out exactly what needs to change from the front line, they may have more positive outcomes. But I just see the system has eroded so much. You have so many people doing more with less, which includes the management team as well.
Mhm.
The upper management, we see more and more being hired on a daily basis through communication, but managers are stretched thin.
Mhm.
So, like I just see that it's everybody is stressed out, and we need to put more time and effort into dealing with those situations and finding solutions. And I think that, like we had proposed bringing in, letting people
Mm.
shadow you in your job to see if it's something you may be interested in. We also see people wanting to change jobs, but not getting the ability to move because there's no one to backfill them. That's why we're seeing people leave, is because these things are happening every day in the workplace, and it's not in positive outcomes, it's creating negative outcomes. And we just need to see more of a inclusive frontline staff being involved, solutions, and a lot more respect of all classifications.
All very, very good points. And I think too, that employers have to recognize that as of April 1st, 2019, there's legislation protecting people that says you have to have respectful workplaces. You have to have a policy and procedure in place. You have to have a committee or people that meet regularly and educate your staff at least annually around these principles of creating respectful workplaces. And they also brought in workplace violence measures in the exact same piece of legislation. So is that actually happening or not? And I would suggest that it's not necessarily happening functionally or practically every day. So yes, we need to do a lot more work around what I call that day-to-day checking in with people to see how they're doing. That's a big picture of respect. It's not just that demeaning, belittling stuff. It is all those other critical features about being present, being engaged. We need to, like you say, invest more in the people who are showing up, people that are there doing the work. How can we support them, acknowledge them, honor them? And it doesn't always mean money or benefits. And you're absolutely right. There's so many things that can happen that are outside of that, because people, if you give them meaningful, good work, are not always needing more money. They're looking for some of the other benefits, like you say, the acknowledgement, or maybe, there's something that you do once a month or something to celebrate people or whatever you do. There's, way back in the day, we used to do, employee parking or whatever, or, gift cards or draws, or, I know one workplace had like a, employee of the week kind of thing, or someone did something nice today. We don't have time. There's no time for that right now. But when are we going to go back to some of that human stuff? And yes, definitely hiring practices is critical. Are we getting the right people? Maybe we have 6 people that would work one day each instead of one person doing 6 days. That's not rocket science. Because there's some people that would like to work permanently part-time forever, and they've got skills, they've got the ability, they've moved here to this province looking for work, and it's not happening. They're not given the opportunity because we're not thinking that way. So you're absolutely right. So I'm just going to go to the question and answer space and see what I've got in here, and I'll open it up to my panel. It says, as a union rep, I'm seeing managers attempting to manage increasing absenteeism due to workload and burnout through discipline and attendance management. It's exacerbating the problem, and managers aren't seeing how it's worsening it. How do we address this? Well, that's a really good question, because then obviously, I'm going to say, maybe I shouldn't be so, but obviously, or apparently, or maybe some of those managers aren't quite familiar with trauma and the impact of why there's absenteeism. It's because it's not what's wrong with this person, it's what has this person experienced. So to deal with it through discipline and attendance management might be a bit disingenuous. Who'd like to answer that? Cathy, Joyce, Norma?
I certainly can speak to that
Okay.
rate because I deal with that on a daily basis. And quite frankly, thank you for the question, because attendance management is a huge problem. It's become even more of putting more people out of the workplace. And I think what needs to happen with the whole attendance management is the employer needs to be more supportive. There needs to be more support mechanisms rather than the disciplinary part of it. What I witness is that when staff, they don't recognize the fact that staff are burnout. They are physically unable to come to work. They are, like excessive workload. There's multiple factors in why people can't come to work.
Mhm.
And when we do the work-life balance, you just said it, Sally, people are juggling way more today with trying to get their children looked after. We have single moms, single dads. There's multiple reasons. But what I'm seeing is once you are on an attendance management program, you are now a rotten apple.
You're targeted.
You're targeted. And it's not how do we improve Norma's situation?
Mhm.
It seems to be how do we get rid of Norma? And that's the downside of the attendance management. It needs to be more supportive. There needs to be more ways to get me the help I need. Does it mean that I have to have in-house counseling? We have social workers inside the healthcare facilities. Like we have access to services to help us in-house. There just needs to be more support mechanisms rather than disciplinary, because quite frankly, when you take me in and you give me a disciplinary letter and I'm already fatigued and I'm already depressed and I'm burnt out from workload, that is just another kick in the can. And it's not helping me at all. It's putting me in a more negative situation where I'm going to go home. And quite frankly, we are seeing more and more very fatal situations coming out of attendance management where people are doing things that they may not have done to themselves, but it's because of that. So we need to really look at the attendance management, be more supportive, and maybe there's the opportunity for their work to change. Maybe there's an opportunity to take them out of the situation, put them somewhere else. I think we just have to have really good discussions and solutions on that with the employers.
Yeah, I agree, because we're creating further trauma rather than looking at what is this person experiencing, what has happened, why is this happening. They go directly to the discipline. So maybe there needs to be some shift in thinking around what is attendance management and its purpose. Because back in the day, before we had working short and all that, that's when these programs kind of came in back in 2010, 2009-ish, where they were more punitive rather than, collaborative anyway. But I think they need to make that more of a collaborative approach, especially now because of what we're experiencing with shortages and everything else, the impact on people.
And I will say that Horizon Health Network has made some positive changes with their attendance management. Vitality, not so much, but there needs a lot of work to be done because the staff see it as still it's still disciplinary. So there's lack of trust in the process changing.
Yeah, for sure. Okay, I'm going to go see the next question. Just a second. I used to work in the nonprofit sector in group homes. I feel a lot of people forget about the frontline group home workers who are dealing with a lot of vicarious trauma in working with vulnerable teens and children. They are also short-staffed and having a hard time with retention. Have any of you heard much about this sector in the province? Anybody? Well, I think there's vicarious trauma in a lot of our roles, but I think that particular group, yes, for sure. Who would like to speak to that? Cathy, maybe?
Well, I can speak to that, not necessarily from my NBNU role though, but it's because I did my PhD study with children and youth at risk. So maybe if somebody can speak more directly from their current role, the only thing I could, just a quick sentence, offer here is certainly we tend to victimize again the victim very often. We tend to take a victim of trauma and continue the cycle with them. And to be trauma informed, we would never do that. We would see someone who has experienced terrible life experiences and be sensitive working with them to help them to evolve and learn to, I could even say, how to re-narrate their story to not be stuck in their own plot. However, as far, I don't have members in that area with group homes with children. Mind you, we do have members who, when the situation wasn't dealt with, it escalated and they became their psychiatric nurses. And this, I keep hearing the mental health and physical and mental health and addictions crisis has not been properly dealt with, and we're feeling the outcomes now. So I'll stop there. I don't know if somebody else might have more to say.
Joyce, do you have anything to add to that?
Well, I mean, it is, certainly, we're representing unions here, and I think part of the problem with, whether it's, group homes or the special care homes and all that, there is that don't have the benefit of having a unionized workplace, right? So any problem we're experiencing, it's probably made 10 times worse because you don't have the access to support from your union and being able to have, negotiate your terms and condition of employment. So I would imagine that, that is one of the problems, is that they're kind of left at the mercy of whatever rules that particular group home decides to impose. And I'm not sure, and I'm just throw that out here, but in terms of regulations as well. I mean, obviously the nursing homes are more heavily regulated, but when you start going down, I would imagine there's less and less regulation and oversight overall.
Yeah.
But yeah, certainly I would it's an area that we've tried to break into, but there's a lot of fear in those group homes because they don't. It's very easy to get rid of you if you don't have a union. Right?
Yeah, and I think Norma brought up a good point that there are resources out there for people. Like there's the employee assistance programs and employee and family assistance programs that are available. I'm pretty sure they're probably being more used now than ever before. But I think also, we've got to make our employees aware that those services are there for you as a benefit. And it's okay to use them and need them. They can help your family, they can help you. They range from, setting out a budget to counseling to mental health, services. So there's a range of things that they provide and services that you pay for. So, it's jointly funded, but those resources are out there. And I don't think people need to be afraid to go reach out and use some of those resources that are there through EAP and EFAP, and that employees, have that opportunity. It's there. So grab it, and, or use your healthcare benefits to get that massage therapy or whatever you need. I don't have time to go get one. Well, you got to find that time because, it will help you look after yourself to look after others. So just some of those things. Don't be afraid to use your benefits to your advantage. That's what they're for. They're for you. That's why they're called a benefit, because they're helpful. They're not hurtful. Let me look at that next question. Continuing education for those in the system would be awesome. However, how can time be made available and supports when people are running short-staffed? Ideas too are needed for this. Okay, who wants to grab that one?
Well,
Go ahead.
sorry. Well, quite frankly, I mean, there's already opportunities in the workplace where they offer education after hours. There's the opportunity to take, it doesn't have to happen on work time. And I mean, but there has to be those incentives and those things looked at. I mean, we have to look at solutions to encourage people to be able to have the opportunity to do it either in work time. And if that's not available, then on time after work, and look at how that can happen. How can we engage and entice people to come after hours to actually have education?
Yeah, and that's a good point. I'm hearing that from nurses a lot too. But if they didn't have to work so much overtime, so many 24-hour shifts, or like I'm hearing many nurses say we never get to leave our shift when our shift is over, because the next person called in sick or something, or somebody was floated somewhere. So I've had a good relationship with Horizon Health, trying to talk to them about training opportunities, because many nurses are saying they're put in, when they're floating, they're put in areas that they don't have enough training for. But I'm told that there's a lot of training being offered. The nurses just don't have time to get to it. And so to offer it on work time, well, there's no time. and to offer it at
can't.
night, there's still no time. So, you know, they're not getting enough time off as it is. So that is a big barrier. It's a huge barrier.
And I just read add to that. Like, I mean, you know, to me, when I talk about giving people manageable workload, I think you have to build into the system things like continuing education, right? You know, because that's what happens. Our members are so exhausted, even if it is a course after hours, you're just too tired and too exhausted to take that extra hour away from your kids or your family. And you know, you say you're running on fumes, and then okay, now I got to do some continuing education. You know, I mean, a key word, it's we have to invest. We have to invest in healthcare if we want it to survive. And there's a lot of talk now about privatization. And I mean, that's just robbing Peter to pay Paul, as far as I'm concerned. If the resources aren't there, all you're doing is you're going to shift them around, and then you're going to take away, you know, basically starve the system as it is now of those resources. And it's in a for-profit type system. So, you know, it's just, we need to rethink, you know, how are we going to survive? And it's not about always reacting to everything. We have to stop reacting. We have to start planning and, you know, having manageable workloads, and start thinking about, okay, what's the additional resources we can add? Yes, we need new professionals and workers across the system. And we have to think of, maybe we need new types of workers, because the new people, the new generation, they are all about work-life balances. You know, we've talked often about flexible workload and said, well, gee, a lot of our members would gladly work 8 hours a week if you gave them the same pay, because that would give them that built-in day to de-stress, maybe do education or whatever, and it would create opportunities for other staff. But we have to stop doing the same thing. It's like, what's that definition of insanity? We keep repeating the same thing over and over and over, and think you're gonna get a new outcome. We're not. We're approaching critical phase, and maybe we're already there. And if it collapses, well, you know, I mean, I don't know. I mean, I'm at the age now, I'm starting to get worried. I'm going to need healthcare pretty soon. So it's not good. And it's not good in the acute care system. It's not good in the long-term care system. It's not good in group homes, special care, you know, mental health. It's like I say, it's like a house of cards, and I'm just waiting for that last thing to come down. And you know, this is critical. This is a societal, you know, issue that none of us can afford to have it go, you know, have it collapse. We're all, you know, we all have an investment in this in one way or another. If it's not you personally, it's going to be your family member, or it'll be you in the future. It's going to be a child, you know, whatever. All levels of society, rich, poor, whatever. We're all in it, and we'll all go down with the ship. It's, you know.
Yeah. I don't see any other questions. It's just, there was a comment that said they're already working extra hours. They need downtime after working long, hard hours. And that's the truth. That goes back to the investment, or goes back to the work-life balance as well. But also that return on investment that we keep talking about, but also, you know, I agree that we have to do an ROI, because none of us would take our money and think that we could retire on it if we weren't going to get something back to actually live on. So the return on investment is about training others, making more things available, looking after the people that are there, putting the money into, you know, bringing new people into the stream and paying for some of that, maybe, perhaps, whatever it takes. But we're not looking at it from that perspective, unfortunately. I don't think the policymakers and the people who have the purse strings. The other thing is, what can we do on that micro level, you know, ourselves, when we're in positions of leadership, or, you know, as union leaders, you know, what more can we do other than bring it and say, look, there's other answers here. You need to hear us. I mean, how do we get heard? What do we have to do? What's it going to take? You know, we're already in a crisis. I mean, there's wings of hospitals closed. There's people trying to have babies and they have to drive an extra 2 or 3 hours. I mean, it's a scary thought. So it's affecting, our communities, and it's affecting individuals, everywhere. And it's affecting all the families with all these frontline workers. When you give the numbers of all the people that you represent, the 3 of you that are here today, plus then we throw in Sharon with all her members, that's a lot of people affecting a lot of people. The ripple effect and the domino effect is massive. So we're taking that trauma home to our families and to our communities. So it's a big, big picture. And, we really need to get some really good solutions, I think, there. Are there any other questions from our panelists or commentaries that anybody would like to jump on board and have a say?
There is one thing, Sally.
Mhm.
There's a comment in the chat. It didn't get posted to the Q&A, but there's a question around, what do the panelists as leaders in healthcare, what do you each do to manage your own trauma that you experience from all of the challenges that you face in the workplace?
I'll start with you, Cathy.
I say my trauma is nothing compared to those on the front lines. I cannot relate. I know, just doing the research, I'm the researcher educator for the nurses union. So, just reading their words, I have tears when I see what they're facing. It's sad, but I cannot at all compare the empathy that I feel as remotely what the real experience is like, for certain. But if I can just pick up on one other little comment that was made here, is I agree we need to make better use of volunteers. I think probably most of our volunteers these days are going to be older baby boomer volunteers, but I think that they're not being asked. We need to ask, and there are some volunteer opportunities, even if it's to help attract new people to the professions that we're also short-staffed in. And again, go talk to schools. Joyce had a great idea. Go talk to schools about what this profession is like, what the rewards are in the profession. So those are some concrete things that I think the number one reason volunteers don't do more, or people don't volunteer, this is what the research says, they're not asked. And so we need to ask. Yeah. Anyway, myself, I don't have the trauma compared to what the frontline workers are doing, are experiencing.
Joyce, what do you do?
What do I do? I mean, I used to be a frontline worker, so when I left, certainly things were not good in terms of workload and all that, and I came to the union. I certainly concur with Cathy. I can't even imagine myself saying I could go back to work in the nursing home industry today. I don't think I would have the capacity. And what they have to do in the time they have to do it. It's just, I mean, I think it's amazing. I think we're fortunate for all the people who decide to choose. And I always said it's not a job. It's a real calling to work.
Vocation.
With vulnerable people. It's a vocation. It's not, and it takes special people to work in this situation. Myself, as a union rep, more and more. I mean, I try to be as empathetic. I'm not going to get emotional because I know how hard it is.
Yeah.
Sorry.
It's okay, Joyce. Norma?
Well, and I still work full-time hours in the workplace. I am a frontline worker. So I have seen and witnessed every day what staff are going through. And that is the people that these other 2 ladies represent. I work in collaboration with all departments. So, like for me, I've seen the trauma, I've witnessed the trauma, and I live the trauma. How do I deal with it? As a union leader, I get great strength out of watching the members that I represent go to work day to day and endure what they're enduring and work through what they're working through. And I take great pride in being the representative that represents them. And it gives me, it gives me the energy to carry on. It gives me what I need to continue to do my work. Is it easy? No, it's not. It's not easy. It's not easy to see your members enduring trauma every day. Trauma in the face-to-face trauma that they endure in the emergency rooms or on the units, the trauma that they experience in their own workload, the experience of trauma that they have when they go home. It's very hard, and we're seeing it every day. We're seeing it escalate, and it's not getting any better. And until there is positive change made in the system, and that those people are respected enough to see positive change, then it's only going to get worse and worse. But for me, it's just being able to have that interaction with my fellow staff members, have the interaction with those that I represent, and just have each other's backs.
Thank you. Now, there was one more question, and Sheila, can I just quickly ask that question? Do I have time? There's 5 minutes left.
Yes, you've got time.
Thank you. Okay. So it says, what are some of the best resources and tools that may help people develop a trauma-informed mindset in the workplace? Is there a community? Should there be a community that people can reach out to in New Brunswick to share best practices and learnings? So I think I could speak to that a little bit, just around our joint responsibility as individuals in workplaces to create a more respectful environment. So for our team members and the people that we work with, our colleagues, the people that we support as well on a day-to-day basis in our own environments, what are we doing to make our, how do we avoid some of the, the escalation, or how do we avoid reacting sometimes, or how do we help others? So I think we have a joint responsibility collectively and individually to create those spaces where we're being more respectful and mindful about our thoughts, our deeds, our showing up, our being present, and all of those things, and celebrating the gifts that people bring to the workplace in terms of their energy, their time, their problem solving, their capacity, their education, their skills. So that's kind of one thing. I don't think there's any sort of one space where you can go, but there's certainly a lot of research done, and Cathy has a ton of research on trauma-informed workspaces that I'm sure she could probably send out a link or something with some of those places where you could go look up some really good information about what it looks like and what you could do. But that's kind of where I would start, is that individual and joint responsibility that we share to create those spaces for people that we work with.
Yeah, if I can just make one comment, and I'm glad that, Sally, you made the point about individual and joint responsibility, because I don't want to take away from systemic issues at all, because most of the issues now, I believe, are systemic.
They are.
However, we can still personally have some agency, or have the power within us to do some things.
Yeah.
And honestly, I'm just going to use I don't mean to demean a situation, but an example is how contagious and infectious a smile or a laugh is. How contagious it is when we just have a certain body posturing. How contagious it is. It's just like anxiety is contagious, negativity is contagious. So is laughter and a smile, and a, the old fake it till you make it. There is a little bit of something there. So we can do little things, but I also liked your idea, Sally, of reach out to EAP and start forming some groups to,
I think certainly, I mean, you have to be what you want to see. You have to be the change that you want to see. You have to, and to me, I'm lucky enough to work where I work now. I mean, we have a great team, and we support each other in many different ways, whether it's that joke the day, or we hear laughter is certainly a good medicine for anybody. But we have to be able to support each other. We have to, if we're going to make change, we can't let it be done to us or have it trickle down like a fairy dust. We have to demand it. We have to live it, and evolve. It will evolve, and certainly resources. That's a great thing. And people's networks can easily get formed. Start reaching out. I mean, we have obviously the social media and things like that. There is some other resources online, certainly. But we need to trauma inform. I think we're more informed than we are today. Become more and more informed. But I think we also have to understand that trauma doesn't have to define us. We can make those changes happen, and certainly put the pressure. And then all the unions here, we do that on a daily basis. trying.
Okay, Joyce, I gotta go. Sorry, lovey.
Oh, time out. Okay.
I want to thank everybody so much for participating, for engaging. I'd like to thank our participants too, who asked questions and offered up comments. And let's focus on what's working well. Let's focus on what is good as well. Because not everything is doom and gloom. So there is a lot of good stuff going on, and we've got some really great humans out there doing this lovely work. So thank you to those people that you represent. We need you and we love you, and all work is very much honorable. Thank you so much. So it's a wrap. We'll talk to you all later.
Thank you, Sally. So we'll now take a break from now until 12:30 is when the next session will begin. And that one is entitled Trauma in the Workplace, Workplace Wellbeing, Staff Stressors and Needs. So we'll continue learning about trauma-informed workplaces and what we can do to get through. So thank you to the
Thanks.
panelists this morning, and we'll see everyone back in 1 hour from now.
Thanks.
Thank you.
Thank you.